हेलो गाइस, वेलकम बैक टू योर चैनल। दिस इज योर सर आदित्य शिंदे। तो आपका स्वागत है अपने चैनल आदित्य शिंदे इनसाइट्स पे। तो आज जो चंदन सर का लेक्चर आने वाला है कंप्लीट फर्स्ट ईयर गाइडेंस के लिए। सो प्लीज वॉच केयरफुली एंड थैंक यू। बाय।
Good morning, everyone. I am Dr Chandan Sengupta, currently working as an associate professor in the Department of Oceanotics and ICAM University College of Australia. So, this short video is just a little bit about how first year students should approach their subjects. That is, this is as per the guidelines laid down by the Medical Council of India and as per the syllabus that is adhered to by the Maharashtra University of Health Sciences. So, starting with the first subject, that is physiology. It is important to have an understanding and orientation of the different systems. For example, there is the cardiovascular system, there is the respiratory system, there is the digestive system. So basically, physiology is a subject that you can cover or that you can understand if you take efforts and put in little bit of time to get the concepts right. For example, the process of digestion. So from where is hydrochloric acid released? If it is from the stomach, which part or which cell of the stomach? If you have to talk about the cardiovascular system, then get the basic concepts like what is blood pressure, pulse rate, stroke volume, heart rate, and the cardiac cycle, and the different stages and phases. Then a little bit about ECG, blood, which is a very important topic. So, what is bleeding time, what is clotting time, what is PT, what is PTT, what is INR? It is important to know this so that you are able to clinically treat a patient as per the particular clinical scenario. You have a proper understanding of the investigations that need to be done, the proper reports that have to be checked to decide whether it is the right time and appropriate clinically to perform some procedure which is required in that scenario. Then coming to biochemistry, because it involves a lot of cycles again, and a lot of enzymes, and a lot of catalysts, and there are names which may be confusing, like adenolase and fumarase and catalase, and dehydrogenase, NADP, NADPH, NADP+, ATP, GTP, ADP. So again, the only way is to revise them and to write down. When I was reading biochemistry as a first year student, I used to make notes, I used to write down each cycle. This needs a little bit of understanding in coordination with your memory, because it is important to keep in mind the names. Then anatomy. Anatomy, as you know, has important components like osteology, embryology, general anatomy. So the number one thing that is important for everybody to get that subject in a grasp is to practice diagrams. Do a lot of diagrams, practice a lot of diagrams, like draw the bicycle nerve, its branches, draw the fascial nerve, understand its roots, its branches, what gives supply to what, about the artery, the vein, neuromuscular supply, something that is very important. For this, you will have to need to know about the organ, about its blood supply, about its nerve supply, technically called as neuromuscular supply. So the only way is to draw and keep drawing and keep revising. And your subject to get the anatomy and release from it again, you need to do a lot of tooth carving and get a proper understanding of the anatomy with respect to different surfaces of the mouth. And for dental histology, it is again kind of conceptual, starting with tooth development, the stages of tooth development, and the different parts like of enamel, like enamel, tough enamel, sticky enamel, lamellae, different types of enamel lamellae. The same goes for dentin. What is circumpalpal dentin? What is mental dentin? What is tubercular cord and what is tubercular canal? So basically, for the anatomy and histology part, again, it is about doing carving, it is about drawing diagrams and getting the concepts right. So I think this approach will be take up the subjects of physiology, biochemistry, dental anatomy, histology, and general anatomy. So I hope this helps, and I'd like to wish all the best to all of you. Thank you.